Hey doc, I've recently started taking antibiotics and it seems that I now have severe diarrhea for the past 3 days. What's wrong with me?
I'm sorry to hear that. Let me see how I can help you.
Sure thing.
Hey, did you check Bob for C. difficile infection?
What is that? That sounds scary.
Well, I'm glad you asked. CDI is considered a hospital-acquired infection in which a bacterial pathogen called Clostridium difficile can infect patients in a hospital setting by colonizing the colon and releasing toxic substances to induce mild to severe diarrhea and inflammation within the colon.
That's terrible. Is it common?
In 2011, C. difficile caused approximately 450,000 cases and was responsible for approximately 29,000 deaths in the United States. According to the CDC, C. difficile can cost the American healthcare system upwards of $4.8 billion, with each case costing the hospital between $9,000 and $30,000. These increased healthcare costs are due to the increased hospitalization time of patients with C. difficile and the high chance of the infection coming back.
How does it get here?
The most common reservoir of C. difficile is found within soil. However, it is also found in sewage and the feces of animals and humans. Once shed in feces, C. difficile can contaminate multiple surfaces and materials, including toilets and healthcare settings. A study estimated that 40% of CDI cases began in nursing homes or community healthcare settings, while 24% occurred in hospitals. These surfaces serve as storage setting for C. difficile spores. The spores have special properties that prolong their ability to stay on surfaces for long periods of time, including heat resistance. C. difficile is also not eliminated as a result of alcohol-based hand cleansers and routine surface cleaning. As a result, C. difficile spores can be transferred to patients via the hands of healthcare personnel who have previously touched a contaminated object or surface. The spores could then enter through the oral cavity and be ingested. Since the spores are also acid-resistant, they pass through the stomach and bile acid unscathed into the human colon, where it settles. But the good thing is that you can detect it.
Let's perform the test then.
Well, it seems I was right. You do have CDI.
Please save me, doc. How do I treat this?
Well, it really varies. For initial treatment measures, certain antibiotic medications are given to treat patients with mild, moderate, and severe CDI, and even for individuals who relapse with this type of hospital-acquired infection. While antibiotics can treat CDI by compromising the bacteria's cellular structure and genetic composition, they can also induce antibiotic resistance onto the patient in the long term due to molecular disruptions caused by multiple unique strains of C. difficile and biofilm formation. Intestinal microbiota transplantation, IMT, is a medical procedure considered for patients with multiple recurrences of CDI. In this case, fecal matter is collected from a proper donor to be mixed with saline and other solutions, and then it is properly strained. Afterwards, this clean feces is provided to the patient through the anus or mouth by a trained healthcare professional to increase their digestive system's bacterial biodiversity. Though there are some limitations with this procedure, like a patient's unwillingness to complete the transplantation and the concerns for developing certain chronic conditions, like obesity or autoimmune disorders. IMT has been reported to increase the cure rates of patients with multiple CDI recurrences by up to 92%. Interestingly, immunotherapy and certain natural products are considered for CDI patients to this date. While that may be the case, further clinical research needs to be done to investigate the efficacy for both treatment methods.
How can I prevent this from happening?
Well, as medical professionals, we can make sure that you're away from others infected by CDI in a separate room. C. difficile is also rare in people who are not taking antibiotics, so limiting the use of antibiotics decreases that risk. We can also use bleach wipes on surfaces to kill the spores and prevent the transmission between patients. You, on the other hand, can make sure that you're washing your hands with soap and water to eliminate the spores on your hands, and closing the lid prior to flushing also reduces the risk of contamination. You can try taking some probiotics as well, since it could prevent infection and the recurrence of CDI. Now, these precautions should remain in place among those in hospitals for at least 2 days after the diarrhea has stopped.
Thanks, doc. You saved my life. I'll be sure to follow these tips to reduce my risk.